Tonight in medical rounds, more than 3 million people live with hepatitis C. It is the most common blood-borne disease affecting the baby boomer generation, but many don't even know that they have it. Joining us now is Dr. Michael Einstein, a gastroenterologist at Hartford Hospital, to fill us in on what you need to know. Good evening, Dr. Einstein. Thank you so much for being with us.
Hi, good evening.
So first, who is at risk for developing hepatitis C?
Hepatitis C is a blood-borne illness, so it's transmissible by blood. Typically those people who are IV drug users, those who have had a blood transfusion before 1990 or have had an organ transplant, those people are at high risk, as well as those people who were born between 1945 and 1965. We see a lot of Hep C in that population.
You know, I've interviewed people who you have no idea. They think they're not at risk because they didn't use drugs, but you really want to get the word out. So tell us about the screening process for Hep C and how you actually diagnose it.
The screening process is very easy. It just consists of a simple blood test which measures antibodies in the blood, and if that's positive, then there's a confirmatory test which sometimes is run at the exact same time. So it's typically only one blood draw, and the diagnosis can be easily made. And
what are the latest treatment options if you do test positive?
Treatment has come a long way in the last 30 years, and today, in the last 5 years, we have only pills to treat this, and cures can be in up to 95% of people who have the virus.
Wow, that's good to know. And tell us about the effects that Hep C can have on the liver, because obviously you want to make sure you treat it if you have it.
So hepatitis C is typically a slow-moving virus, and over long periods of time, in some people, it can lead to cirrhosis. And cirrhosis can cause fluid to accumulate in the abdomen. It can cause varicose veins to develop in the esophagus and sometimes break open and be life-threatening. It can also cause confusion and in some cases can lead to liver cancer. So it's really important to be screened and linked to treatment if you have the virus.
Thank you so much, Dr. Michael Einstein, for sharing this information about Hep C with our viewers. Thank you for being with us tonight.